Hi everybody, my name is Chris Norman and I'm one of the counselors at the Community Counseling Center, and today I'm joined by Jennifer Uharic, our clinical director at the center, and thank you for joining us today.
Absolutely, I'm happy to be here and looking forward to talking about our topic today.
Exactly, yeah. Today we're actually to talk about something really important. You know, during this time with the coronavirus happening, a lot of people are being affected by anxiety and depression, and so we're going to talk today how to manage that. For many, it's kind of a momentary feeling, but for others, it may last a little bit longer. And so we're going to kind of dive into that today and talk about how you can manage both anxiety or depression depending upon what you're dealing with. And so I'm going to start out today talking about anxiety. And so you may be asking yourself, well, am I even experiencing anxiety right now? Well, here are some of the symptoms to be looking out for to see if maybe this is something that you're dealing with. So look for uncontrollable worry, excessive nervousness, sleep problems, upset stomach, poor concentration, muscle tension, or even increased heart rate. If you're experiencing several of those, then it might be that you are experiencing anxiety, more than just a temporary stress, but maybe something that's happening more often. And so if you do relate to those, there are some self-help skills that you can use to deal with it while you're at home, staying safe at home. And these are primarily called relaxation skills. There's a whole group of these things that you can do while you're at home to take care of this anxiety. These are things such as deep breathing, mindfulness. There's also things such as progressive muscle relaxation. And these are all things you can do at home. And so after our video, make sure you check and see. We'll post some information about how to do this just from the comfort of your own home. But for others, you may feel like, hey, this anxiety is more than that, and I need a little bit more help. And so Jennifer and I are here as well as our other counselors available to help you through that. In fact, we do have a free anxiety and depression screening available from one of our licensed counselors. So just reach out to us and we'll set you up with that. But while some people may be dealing with anxiety, Jen, I realize that some people may be dealing with depression. So tell us a little bit more about how to cope with that.
Thanks, Chris. So depression, you'll notice when you are experiencing an actual clinical depression, when you start to have the symptoms that I'm about to describe that last for about 2 weeks or longer. Mm-hmm. So on a mild level, everybody might experience depression at times, but it's not necessarily a clinical depression. But if it actually reaches the point of a clinical depression, here's what it's going to include. You'll have a depressed mood, a sense of irritability, difficulty concentrating on things that you might have been able to focus or concentrate on before, a sense of decreased motivation, a loss of interest in some of the things that you would typically be interested in. Like if you typically like to exercise or like to go hang out with friends, maybe now you don't really feel motivated to do that exercise and you just kind of want to isolate in your house a little bit more. And sometimes a sense of hopelessness or even thoughts of suicide. And if you're experiencing mild depression, just sort of a low level, which I would say most people might experience some of that at some point during this time of dealing with the virus, you can do some of the basic things that we do with depression and treating that, which is to get out into nature, to practice mindfulness, like Chris mentioned. That's something that mindfulness helps us just manage all emotions of any type, and it helps to bring balance to those things. Volunteering, believe it or not, we can still even do volunteering online right now. There are ways to do it. Get connected to your church, to other organizations that you've been involved in during the year so that you're not isolated. Practicing things like your sleep cycle and keeping it regulated helps us. So you want to try to get a morning wake-up time at, let's say, 9 o'clock, because our structure's been lost, and the loss of structure causes an increase in depression and anxiety. So we want to add a little bit of structure. So you might wake up 9 o'clock and make sure you get yourself to bed at 10 o'clock or 11 o'clock. Try not to get your days and your nights reversed to where you stay up playing on a game or playing on your computer or just reading news obsessively until 2 in the morning. The key is to try to bring some regular cycle to your body so that it gets what it needs during a time like that. Also exercise, just getting into a routine that you have indoors or getting outside into nature and doing your exercise outdoor, taking a walk, taking a jog. I know that we can't really be closely touching other people at the moment. We're trying to demonstrate our social distancing, but we can absolutely still go out and take a jog or take that walk around the block or down through the neighborhood. Also, you can do things like set goals for yourself because giving ourselves a sense of attaining or accomplishing something does help to lift that depression as well. And then tracking it, and then when you accomplish it, reward yourself in some nice way. For me, when I've done my chores, my housework, which I hate to do, I do have to reward myself afterwards. So typically afterwards, I'm doing something fun, like watching a movie, or I'm taking a nice long bath, something that I find comforting and soothing to me. Now, if the depression reaches a more serious level, if it, as I mentioned, lasts for about 2 weeks, and then it doesn't really resolve and it feels like it's really starting to get to you, or you start to really have more suicidal thoughts, then we want to step it up a notch. That's when you want to go ahead and contact our counseling center or another therapist that you might know. You want to go in, and we do online counseling right now, and I know most of the therapists that I know and I'm in touch with, they're all doing teletherapy, and you're welcome to do that during a time like this. It works the same. A lot of people, even myself, thought it would be kind of weird at first when we started doing it. We thought it would feel unnatural, but it's actually turned out to be quite fun and actually incredibly helpful. Everybody I've been talking to has said at the end of the session, this was so not what I expected it to be. It's been really helpful and has resolved so much of what I was so worried about today. So you would step into therapy. If there's a need, then we would also talk about medications. Medications of different types can be used to treat both anxiety and depression. And then if there's suicidal thoughts, there's other levels of care at that point.
Yeah, thank you for going into that. Especially, like you said, sometimes if the anxiety or depression gets too full, we may have a suicidal thought, and it's kind of normal to have that, and is to know how to handle that. So thank you for going into that.
Absolutely.
So if anyone is experiencing a higher level of anxiety or depression than just a normal everyday kind of feeling, reach out to us. Like I said before, we do have some free anxiety or depression screening times available with one of our licensed counselors. We'd love to set that up for you. You can reach us at our counseling center. And then also, Jennifer and I and other counselors are available for individual counseling through telehealth. It's really been interesting how we've been able to connect with people through video and feel like we're just right there with you in that process. So reach out to us. We want to make sure that we're available to you in any way. So just know that our team is praying for you during this time, and so let us know what we can do to help you. Feel free to comment on the video about what's happening in your life and how we can come alongside of you. And we look forward to being there for you during this time.
And I feel like I better go ahead and add one last thing, because I was talking to Chris the other day, and one of the things I'm especially concerned about right now is suicide. And the reason for that is because when people tend to be really depressed and become more isolated, suicidal thoughts can surface more, especially for those who have clinical depression. So it was just really on my heart, and I wanted to kind of share a little bit about how to respond to that before we wrap up for today. So if you yourself are experiencing suicidal thoughts, just understand something. It's normal when you have depression to have that happen. So don't freak out if it occurs, but do pay attention to it in a way that's helpful. So what we would want you to do in a situation like that is, if you're having those thoughts, you do need to start to now talk to someone who's a loved one so that they can either help you get connected to a therapist, or just call the counseling center or a therapist that you're already involved with directly. You'll let them know you're having those thoughts. If you have a friend or a family member or a loved one who you're concerned about, you think maybe they're having that, they seem to be acting in ways that indicate that, but they haven't said it to you, go ahead and ask the question. Be very direct. Say, hey, are you having suicidal thoughts? Because sometimes people avoid that question. They're like, oh, I didn't want to offend, or I didn't want to make them uncomfortable. Hey, you know what? If they're having suicidal thoughts, it will be such a relief to them to know that you've asked them and that they can start to talk about it. And just sharing that with you will help them to feel a great sense of relief. And then you can talk to them about some of these suggestions about getting connected to a therapist or a professional that they have been involved with in the past to assist them in that process. Yeah. But anyway, so I wanted to add that in today. Yeah. Thanks for that extra little bit of time.
No, that's great. Yeah, of course. It's important to talk about this because we want to know that that when you have those kind of thoughts, to talk about it with somebody. Don't keep them to yourself. If there's no one you think you can talk to, reach out to us. We're here for you. We want to make sure we're available to walk with you through those types of things. So reach out to us. We're here for you. And thank you for watching today, and let us know how we can help.